Hi everyone. Today we have invited Dr. Sam Dasanayake from Sahandro Ayurvedic Center to talk about something very important for our day-to-day lives. Now, a lot of us, when we get some symptoms, we either ignore or we just postpone because of our work related task, or we always give priority for our work. That's the normal practice. Now, Dr. Sam, first of all, welcome to Sri Lanka Morning Show program once again. Now, tell me, is that a good practice?
It's nice to be back, Tushara. Thank you very much. Ignoring symptoms for one reason or the other is not a good practice, because now we know the culture in Australia is that we are very committed to work. So we continue to work regardless of whether we are in pain or not. Now, most often what we have seen is that if you get a headache, if you get a pain, neck pain, shoulder pain, hand pain, we continue to ignore that because of the availability of pain management medicine. It's available over the counter, so we continue to take that and continue to go to work. Now, this is not a very good practice. Now, we can ignore a headache if we have not taken enough rest. We can ignore any pain if you had a fall or an injury, or if there is a tooth extraction.
In other words, if we know the cause.
Yes. If we know the cause, then depending on what the issue is, we can go for pain management. That is fine. But this pain that we are talking today, pain is a symptom. Whether it is a headache or any other pain, is a symptom of fever. Is a symptom that body gives us to let us know that there is an issue. So what we need to do is look into it, look into what we have done in the past, and in most cases it only requires for the patient to take a rest, take a break from work, stay at home, take a good rest, eat well, drink plenty of warm water, and most likely your pain will slowly subside. But if you override the pain, go into painkillers, continue to do that, then I think you're falling into an area where it is inevitable that you will be diagnosed with one thing or the other.
Now, with this current COVID-19 situation, some people are reluctant to go to a medical center or seek medical advice, or sometimes with the work from home environment, there are chances that we get continuous symptoms. So what you recommend, what would be the best practice to follow at home when you get these continuous symptoms?
Absolutely, Tushara. It is imperative with the current situation that most people are complacent or hesitant to go to a medical practice or to seek medical advice.
True.
I can quite understand the situation. Nevertheless, if you have pain repetitively in any area, depending on what it is, that is a definitive reason for you to seek medical advice. Whether it's Ayurvedic or allopathic medicine, it doesn't matter. You need to seek the doctor. If you have continuously headache, it could be a dull headache, it could be a severe migraine type headache, you need to seek advice. You shouldn't take refuge in pain management. Now, the reason is, if you continue to take Panadol and go to work or commit yourself to work or do other things, your issue that the body has raised is going unresolved, and it will only get worse. It will not find a solution on its own. So, wherever the pain is, if it is a neck pain, if it is a low back pain, hand injury, knee pain, whatever it is, even in terms of digestion, if you think you are bloating all the time, if you think you are burping all the time, some people then continue to take small portions. No, if it happens far too many times, that means your digestion is poor. So you most people either go to a chemist and find some solution. What we say is, if it brings you cure, that's fine, but most likely it will not. If your digestion is poor, then you need to improve your digestion. Who's going to give you that advice is either doctor or an Ayurvedic doctor. So you can see why. So going and doing a consultation over the phone or visiting the practice. But nevertheless, this is the pain or swelling or fever or a bloating is a symptom that is telling you something. Please don't ignore that. Please don't override that by taking pain management, because you are heading towards disaster. So it is like a train going in the railway track, ignoring the train signals.
Now, Dr. Sam, just suppose that if someone got a dull headache or bloating for a long time or continuously, so can that particular person consult a doctor over the phone, or do they definitely have to go to a doctor, or is there anything that they can do at home?
Certainly. Now, most times, especially during these times, people make contact us over the phone. If the symptom is fresh, if it hasn't been there for a long time, let's say for an example, if you have dull headache, then what you can do is you can contact us, or you can try doing some steaming with eucalyptus oil. Now, if it is a issue because of dried phlegm causing the congestion, if you steam with a little bit of eucalyptus oil, you do it for about 2-3 days, that headache will slowly go. Now, if the headache is due to tension because you are nervous or anxious or you are overburdened with work, if it is overburdened with work, then you need to make sure you manage your workload and take enough rest and drink plenty of warm water. Now, if it is nervousness or anxiousness because you don't know what's going to happen, then you will have to get some Ayurvedic herbal preparations, because we need to make you at ease. Most oftentimes people can't do it on their own. Now, if it is a digestion related issue, if you find continuous bloating, even though you are, if it's a fresh one, then what you can do is you can take some curry leaves, remove the curry leaves and take the stems. So, handful of curry leaf stems, chop it, and with 2 tablespoons of cumin, put 4 cups of water, boil it and reduce it to 2 cups, and then have half a cup with every meal. You do it for 2 days, that bloating will go. So, this is bloating if it is a new one, but if you had bloating for a long time and if you had taken Nexium or Gaviscon for a longer period of time, and if it's not working for you, that is definitely Agni dosha. So, you need to visit the clinic and get Ayurvedic medicine. But now, with Ayurveda, we give medicine for maybe a couple of weeks and we stop medicine and you are fine. We are not asking you to take medicine for a longer period of time, like other types of modalities where they continue to give you medicine to get relief. It is not the Ayurvedic way. So, if we say it is a cure, which means you take it for a certain amount of time and then you are off any medication and you are on your own and you don't see the symptoms. The same way, if it is a musculoskeletal issue, also you can take a rest, you can adjust your seat, adjust your vision with the computer screen, and stretch. Apply some sesame oil or coconut oil and apply heat. Put a heat pack that will reduce the tension. So, these are very simple things that you can do at the very beginning to reduce the tension. Now, if you do not do any of that, if you do not apply heat, if you do not put any oil to untangle the muscle fibers, and you continue to take pain medication, that is a very drying substances, that will exacerbate, and it will escalate to a situation where you will tear your muscle if you are putting weight. If the symptoms persist continuously, then you have to seek medical advice. And also I should mention that this is all general advice. We haven't seen the patient, we haven't done the Nadi Pariksha, Sparshana, Darshana and Vimarshana. So, these are 3 things in Ayurveda that is a must. So, you have done that. So, this is just general advice.
Right. Now, one last question, Dr. Sam. Now, a lot of people have an impression like in Ayurvedic medical treatments, they treat for the root cause, not for the symptoms. But in mostly in Western medical treatments, they treat for the symptom. But in Ayurvedic medical treatments, it will take longer. So, people have that kind of impression. Is that right?
In Ayurvedic medicine, we treat for the root cause. That is very true, because we try to bring a balance naturally in the person. That might take a little bit of time, because usually when they are visiting the Ayurveda doctor, they have tried all other modalities, and failing, they will see Ayurveda as the last resort. So, then it is a chronic disease that we are trying to treat. So, it will take a little bit of time, not long, but after about a week's time you will see the progression. If it is a pain, its pain is slowly subsiding. If it is a digestion issue, you will see that you are no longer seeing those symptoms before. So, there is some confidence that the patient get. Now, if it is a broken thing and they are coming for us without doing surgery, you will see that movement is slowly, you are gaining back the movement. So, it is like that. Always the patient has to be confident that they are going to have a full recovery in Ayurvedic treatments, and by practicing Ayurveda here, we are committed to give the patient complete recovery with the shortest possible time, with the little amount of inconvenience to other areas. If you are a tram driver, we can't take you off from work for a long period of time. As I said before, the culture is that you have to go to work, otherwise either you will lose the job, or there will be other complications in terms financially.
So, thank you very much. I think we discussed a very important day-to-day lifestyle related matters today. And once again, thank you very much for joining us, and we would like to have you again to discuss about some important matters in another week. Thank you for joining.
Thank you, Tushara. Thank you very much. Channel 31, Aibowan.
There's no better place on earth. Yeah, I dream of you, Sri Lanka. Yeah,
I pray for you, Sri Lanka.